Sup, guys? Welcome to the PT Good podcast, where we talk all things ortho, from physical therapy to training. My name's Kane.
And my name's Mark.
So, Mark, what is on the agenda for today?
All right, Kane. I want to start with a question for you. Did you attend physical therapy school?
Dude, I just got a flashback to Suits, and I am Mike, and I'm a fraud. I have never been to school. I just memorized all the stuff. Never ever took boards, and I'm just out here treating people. It is what it is. You caught me.
I have no idea what you're referencing, but I'm going to assume
You've never seen Suits?
I'm going to assume your answer is yes. Is that a correct assumption?
Yes. Yeah, of course.
You know what? I also went to PT school, and I think us being former attendees and graduates of PT school, we have a little bit of merit to be able to talk about today's subject, which is revamping PT school. Now, I want to preface today's episode by saying, hey, we understand the purpose of PT school is to pass boards. We understand there are administrative barriers to changing programs, changing content, restructuring stuff. So like the purpose of today's episode is not to talk about, changing school to change the goal being to pass boards and to restructure it immediately in some drastic way. Rather, the goal today is to talk about how we can make small changes in order to restructure PT school to better prepare clinicians while also working to passing boards, right? So again, we understand school's there to teach you so you can get your license, and then a lot of the professional development is up to the individual afterwards. But we think there are some changes that could be made to achieve both goals at once. So, Kane, I mentioned a little bit about constraints. I mentioned a little bit about barriers in terms of restructuring and changing content. Would you be able to talk to us a little bit specifically about some of those constraints?
Yeah, sure. And I think that the biggest constraint is going to be your boards passing rates as well as boards content. That is the number one dictator in regards to what content is featured in your curriculum. You need to be exposed to it because that's what's going to be on your test. And honestly, you could have the best program in the world. You could be teaching people to be like super, super advanced clinicians, fellowship level. None of it matters if you can't pass your boards and acquire your license, right? So that is the number one gatekeeping thing for different content on for PT programs. The next thing would be CAPTE accreditation standards. Now, I don't know all the ins and outs. I'm not like a full-time faculty member or anything like that, or have anything to do with a program, but CAPTE, to my understanding, definitely has some requirements and some standards on what your curriculum should entail and how it's kind of structured. Like the school still has the overall final say of what exactly they want to put in, but CAPTE still has to say, hey, like this meets our standard and you guys are good. Essentially, I think CAPTE just wants to make sure that the programs are overall pretty standardized to contain like the core things that they really want, and the things that aren't part of that, you can teach whatever it is that you want to teach and however it is that you want to teach it. So you definitely have a couple of limitations there. The next one, I think, is probably going to be the biggest limiting factor from the student perspective in regards to like what you can or what you shouldn't be teaching. And that is the student's capacity to learn and critically think. A lot of these students are coming in with no prior education. They are coming in with like maybe a kinesiology background and exercise phys background, but they don't have as much background in regards to higher level thinking, critical thinking, or just clinical skills, right? So it makes it really hard to have those types of conversations or teach these students those types of skills when they are just simply lacking that foundation for right now. I think that that is ultimately what we want to be able to get them to be able to do. And we see some students that come in that maybe they have a previous background in athletic training, or they have more exposure to the field, or maybe they're just bright, and they have a whole lot of room to continue going in regards to the clinical decision making. But a lot of students do not have that coming out of college. So those, I would say, are probably the biggest constraints for PT programs and what they can or can't really teach.
Mm-hmm.
Anything that you want to add to that, Mark?
And for those who don't know, my understanding, CAPTI is the accreditation board essentially for schools or PT programs.
Yes. Right. So they pretty much just ensure, is your program legit? Can it be do they pass their accreditation standards for them to actually be a program at that point?
Right. Gotcha. Okay. So you talked to me about constraints. I hear what you're saying. I think there's some counter arguments to be had, right? So I think first and foremost, sometimes when you talk about, there are people propose changing a program, adding content, removing content, or replacing content, it's like, oh, we just don't have the time to do so. Our schedule's jam-packed already. We have our coursework is full. We need time for clinicals. We need time for experiential learning type things. But I think it's pretty easily rebutted in that, like, most programs we see are just getting shorter, right? You have PT programs that take 2 years now, right? Where it's like, at least when I was in school, the quickest program that we heard of was 2.5 years, and those are few and far between. And the most common program length was 3 years, which I think maybe still is true. But there's more and more programs that are hybrid, or where they're able to take more students and reduce the length of the program. And then it's just, again, they're putting all this information in there, and I don't know if it's because the program length is getting shorter. I don't know that they can say they don't have room for more content, because listen, you cut a year out. Not saying you have to make your program longer, but clearly if you're able to put all this content into a single year, there's probably room for something, right? So programs are getting shorter. The argument that, hey, we just don't have room for it, doesn't seem to hold up in that regard. Now, yeah, is there something you want to say?
Oh, yeah. I feel like with the fact that programs are getting shorter, they are trying to force so much content into those 2 years now, that a lot of it is what they're essentially cutting out, I think, are things that could be advancing these students in the direction that we wish that they could be pushing them towards, where you could have higher level classes for these people, right? Where you could definitely have different ways to expose students to just more advanced topics. I think that is huge, but a lot of the focus within the 2 years is going to be stuff that is essentially just to get you ready for boards, which I think that's great and all, but it's you still want to create good clinicians, right?
Well, and it's funny that it's like, hey, we're going to do as best we can to prep you for boards in 2 years. But the data is public. These shorter programs just tend to have a worse boards pass rate compared to the longer ones. So if the idea is that, hey, we get all the necessary content in there so that you can graduate quicker, and you still get all the required information, you still get all of your clinical hours in, hey, yeah, maybe you are graduating quicker, but your chance of passing boards, not even just on your first try, but your ultimate pass rate is significantly lower than that of longer programs, right? So there's a bit of a trade-off there, right? Maybe, I don't know how these programs are being marketed, but it doesn't seem to be that they are maintaining the average board pass rate. They seem to be lower, and they're not preparing clinicians better either, right? It's just hey, you can't be a prepared clinician if you never get to become a clinician, right?
Exactly.
Yeah.
It's just like, it's so crazy that they are still trying to force this. And listen, I get it. You're saving a year of time, or maybe half a year of time,
Hmm.
but you could really be doing so much more with with a 3 year program compared to the two, right? Like you are cutting out so many aspects that really could be vital
Yeah.
in creating better clinicians, and like use your time more wisely. Like why make it shorter if you are offering a compromised product and
Yeah,
service to
exactly.
these students?
The other part too is like it's not necessarily the education cost. It doesn't seem to be necessarily cheaper either. You're still paying for credit. The credit there's still a certain amount of credits required. It's just like it's you're taking some online classes during your clinicals, so that makes up for like semester stuff like that. Some things are shorter or like so it's like you're not even saving in that regard. It doesn't really seem to be doing a lot. Now, next point here, I think is a big one definitely, and that is about the courses, the kind of information that is taught in school, right? So I think a lot of courses are important. I think most of the courses have some relevancy when it comes to passing boards. Some of them have more relevancy than others when it comes to clinical decision making, things like that. But some of these courses, I don't know, they just don't have, they're kind of fall lower on the totem pole. So, first one here was not part of the curriculum of the school I went to, but I know it was part of the curriculum at the school Kane went to, and he is certainly passionate about the place that this class had in his program. So, Kane, why don't you tell us a little bit about business and leadership?
Oh man, this is a class that I think needs to be removed for sure. I think it's good to have exposure to maybe the like business model of having a cash-based practice, your own practice, whatever it is, insurance reimbursements, which they don't even talk about. But there is simply too much content to teach in regards to a business, like a business type of class, or being able to manage your own clinic or manage your employees. There are individual courses for each of those topics. How are you going to condense all that into one course? And the other thing is, majority of students don't go on to create their own practice. It's a huge minority that end up doing that. Like a very, very small amount of people actually end up doing that. And on top of that, there are so many resources out there that teach good business practices way, way, way more and way better than what the school could potentially offer as PTs. Like this to me is like they are trying to like filter a business model specifically for PTs. And I'm just like, dude, a business is a business. It doesn't matter if it's for PTs, for physicians, for construction, for any type of service. A business is a business. You're going to run through very similar theories, models, ideas. Like all these things can be taught in a way better manner compared to just a one semester course that most people aren't going to use. I think that is just so like inapplicable, and it's just like it's rigid because you can't really flex this in any other way.
Right.
Like kids just aren't going to use this,
I'm so surprised that a class like that was part of your curriculum because I can't imagine from when I took boards there wasn't any kind of questions on this. I don't remember any. I don't see how it really fits in the curriculum. I also like when you're weighing your options on like the amount of time or like credits or stuff that you could fill in your curriculum, I can just think of so many other better things that could take the place of a class like that, right? I don't know if it's like maybe the preference of the faculty or what it was, but to me I'm with you, man. Especially the way you describe it, I don't see it having a place, right? It doesn't work us towards anything. It doesn't really work us towards preparing people from a clinical standpoint, nor does it have applicability when it comes to boards pass rates.
Yeah, or actual didactic content too.
Right,
But
right.
like one of the things that drove me nuts, I remember having like our capstone for that class was creating a business proposal for a cash based practice. That was like what my group was responsible for. And when we were discussing the plans for it, they're like, oh, okay, so when do you anticipate making a profit here? And I was like, probably not within the first 5 years. 5 to 8 years, maybe then we'll turn a profit. And my professor looked at me and was like, what? Are you sure? And I'm like, I don't know what kind of business you think that you're going to be able to turn a profit for. If you are taking this big of a loan to get all of your equipment, cover all of your overhead, to purchase or rent out a facility, to pay your employees. If you think that this could be done in under 5 years, I would really love to see how that's possible.
It's easy. You just make money. That's it. It just happens. I don't know what you're talking about. Bro.
Like
Clearly you didn't learn anything.
Like when I was discussing, I was like, you realize like marketing and advertisement takes money. Like that is a huge thing. Search engine optimization to be able to do that. Like it's crazy. Like absolutely unbelievable.
Yeah. So, yeah. Business leadership. Goodbye. Okay. Next up, massage and modalities lab. Listen, this is a big part of my school. 4 hours and 4 hours each. People looked forward to it. The faculty who taught the class like hyped it up the entire semester. We got there. They gave us like a bucket's load of oil. We just rubbed people for like 4 hours straight. My hands hurt. I stopped. I sat there for the remaining 3.5 hours. I got yelled at. I told them I was done. I'm not doing this. And look, been a PT for a good amount of time now. I still don't do it. I'm not going to get all slick, all oiled up. Just, first off, let's talk about our points here. Relevancy of the boards. Nope. No questions on massage. Making you a better clinician. That's not the kind of manual techniques that's going to make you better, right? It's basically therapeutic touch. I'm good. I don't need it. Doesn't have a place. Give me something better. Next, modalities. Again, I can put a hot pack on. I can put ice on someone. Also, people can just go to CVS and buy these things. I don't even know how to pronounce this. Kane, correct me. Like diathermy.
There you go. There you go, buddy.
Ultrasound. You don't even have to turn the machine on, and I forget which direction, but it's don't turn it on. And what do you go counterclockwise? That's the most effective way to do it.
Sure.
So yeah. There's an actual study on that, but it's like, listen, these kind of things. I get it. Modalities, yeah, it's on boards, but give me like a 1-page Word document what I need to do with that. Don't waste my time showing me a hot pack, showing me a laser, showing me like the ice machine, like ice massage. Take a Dixie cup and you put it here, and you got to let it freeze for this long, and you move it around this 1 centimeter of the skin, and you look for it to turn red and get like, listen. Just, I'm good. I don't want it. Okay. Next up. And we're going to talk about streamlining stuff later, but I think these two classes could certainly be streamlined, make them into more of like a online type thing, or just speed them up. We got ethics. We have evidence-based practice. So ethics, right? It's like, at least the state that we practice in, or I practice in, ethics, it's like a requirement. I get it. Like, teaches you how to interact with a large variety of people, different backgrounds, cultures, etc., which is important, right? I mean, especially as PTs, a person-facing profession, like you need to, I think, getting some information on that, getting some knowledge, learning, getting a little bit of, not how to interact, but just like, just some background information on just interacting with people of all different backgrounds. I think it's positive, right? So it certainly has its place. I think from a clinical standpoint, it's beneficial. I don't think it needs to have specific in classroom time allocated, and the amount of time that the course, the program I was in, it was almost like nearly as much as like a regular, class. And then similar to the evidence-based practice, it's like, hey, I don't see a reason to have a separate class for it when something like that could just be seamlessly integrated into other classes. It's like, hey, you have neuro, you got cardio, you got muscular. It's like, hey, we know like within each of these topics, like where evidence-based practice is going to fit in, right? So I think it can be kind of integrated in that degree. I don't think necessarily having like a full class for each of those is 100% necessary.
Yeah, and I feel like for EBP as well too, like you could essentially just condense a whole lot of it into like a handful of lectures to understand the stats and like the relevance and what they actually mean. I really think that that's pretty much all that you need, right? So like I feel as if that is one of those classes that does not need to be for my program, for example, was 3 separate classes. I'm like, listen, I don't think that that's necessary, right? So the next one that we have is interprofessional education, which sounds awesome in practice. I think that my first exposure to actual interprofessional like relationships was in the hospital setting where you're working with OTs hand in hand. They are your counterparts. You have to like they if you do not have a good relationship with them, you are not going to have a good time because they do pretty much the other half of everything that you're doing. You're pretty much doing co-treats the entire time that you're in the hospital. So I thought that that was great. However, in actual classroom settings, that is not the exposure that I had. It is just you sitting there and being with all the other cohorts and just getting lectured at and forced to talk about things that aren't necessarily applicable for either of our fields. Like they try to find a way to combine everything that we do, but the things that we do are so different. There's some overlap, but it just really doesn't work super well. So it's one of those things where it's like, honestly, send everyone into the hospital to see how a PT and an OT and an SLP function together. Maybe spend some time with a PA and a physician, and then you can actually see what a real dynamic should be like versus just being told, right? That's one of my biggest issues with interprofessional education. It's just, it's not very applicable or practical in the real world. I think it's great in theory, but the way that it was presented to me, I just didn't really agree with it. I don't know if this is the same experience that you had, Mark, but yeah, not exactly the happiest camper when it came to that course.
Yeah. So we have this class. I don't remember a single thing about it, so I don't know if that's good or bad. Maybe that means it was like flew under the radar and we just cruised through it, or maybe that means it was painful enough that I blacked out. I don't know, but
repressed memory.
Yeah, exactly. But regardless, yeah. Another thing, it's like, hey, probably has some clinical relevance. Probably is beneficial, but could it be implemented differently so other things could fit in, right? Okay, next two here.
Absolutely.
Next two here hit home for me. We got Cadaver Lab and the Neuroanatomy Brain Lab. If I could take Cadaver Lab every summer, I would. Right? I think best class. Very enjoyable for me. I TA'd for it. Same thing with Brain Lab. Brain Lab I didn't enjoy nearly as much, but again, these classes in the program I was in, or actually Cadaver Lab was the first class you took. It was over the summer. It was about 2 months long, and it was almost used as a trial, like a test. It's like, okay, some people, maybe 10% of the class is going to make it through this, and it was basically to show, I think, if you could handle the workload of PT school. Now, what we can bring in the question is, yes, it gives you a good foundation for anatomy, which helps you with like your classes going forward, but it's like, how relevant is it? Do we need to actually be like cutting open cadavers? Could we do more of like the modern approach where they're using the interactive virtual tables and still learning stuff? I think we can start to like draw that into question, right? Where it's like, do we need to spend all this time and resources and effort into like actually like making incisions and dissecting, which is really cool and stuff. But again, like we could probably learn anatomy more efficiently, and the same goes for Brain Lab. Like the brain anatomy is probably even less relevant than the cadaver anatomy. So I think there's maybe a more efficient way to do it. Now, that being said, I think you need to know anatomy. I don't think there's anyone's question that when we talk about our 2 points, when it comes to board's relevancy, you have to know it. It's your foundation for everything. When it comes to the clinical relevancy, again, when you are doing your differential diagnosis, when you're evaluating, palpating, whatever it is, you need to know anatomy. So I definitely think you need to know it. I mean, like I said, I would love to give everyone the opportunity to do cadaver lab, but if we're looking to prepare people better clinically, maybe there's a better way, more efficient or time efficient way to learn those topics.
Do you think that because we became a doctoring profession, that's why they made a push for us to do more cadaver dissections and more like actual brain dissections as well too,
I don't
and
know.
understand the
Yeah, I
anatomy
mean
behind it?
that's possible. I always thought of it, and I don't know why. Well, I always thought of it as like it's like literally like it's like step one. It's like some a certain amount of people just aren't going to pass, and it's like it was basically just like cutting you loose before you got too far into the program and wasted your money on it. That's the way I thought of it for whatever reason. But I don't know. Maybe it has something to do with just adding credits and whatever board decided when this became a DPT, it was like, hey, like look at this, like we're cutting pelvises in half and we're dissecting people's faces and we got a cadaver, and it's like, yeah,
We're doctors now.
Yeah, I'm a doctor. Time to do surgery. But yeah,
Yeah.
it's possible. I haven't thought about that way, but yeah, it's certainly possible. Maybe it's just like, hey, we need to add more credits, and this was like a prestigious class to get some of those credits in.
Yeah, but like think about if the whole point of it is to learn anatomy, how inefficient it is where you're actually having to dissect and prep the cadavers.
Yeah.
Like you don't have to do that to learn anatomy, right?
Yeah, you didn't have cadaver, right? Because over half the time was literally like just taking like blunt scissors and spreading them open and like getting through tissues and stuff, and it was just like you had to be really delicate with like nerves, then you had to like clean stuff up, and like it was just like it was very tedious, time consuming. Then once you got the actual structure cleaned up that you're looking for, and it's like, oh, there it is. Now I just need to memorize where it is and what it does, stuff like that. But again, like with the tables and the virtual type thing, it's like you cut all that out so you can get right into what you need to know.
Yeah, and how many students just straight up hack their cadavers up? Like there's very minimal finesse when it comes to the prep.
Yeah, you would just get reamed by the teachers if you did that where I went. You'd get like banned. You'd get banned from dissecting. They would just be like, nope. All right, next up. This is a Kane class, Foundations of PT Practice.
Oh, God. Man, Foundations is essentially literally teaching you about the history of PT practice. I really don't need to know a whole lot about how PT came to be. And like they teach you the different models and stuff like the biopsychosocial model, which is great and all. But listen, that could be covered in a day. It really doesn't need to be a full course. That's all I got for this, man. That's just get rid of it.
Yeah, I didn't have that one, and I'm glad I didn't have it. All right, next up, wound care. All right, so definitely has relevancy for boards. I mean, you get questions about dressings and like wound beds and granulation tissue, stuff like that, whatever. But the clinical relevancy, like what percentage of PTs are going to go into wound care? It's like it's got to be a fraction, like 0.01% or something like that. It's like I mean, listen, I haven't done an inpatient experience where you had to deal with wounds like that, but it seemed like the nurses always handled it. So honestly, if wound care wasn't part of our scope, like I'd probably be okay. So another class that could be applied more efficiently. Like it doesn't need to be a full semester, 4-hour class. It could be online. It could be, maybe half the time. It could just be something where it's like, hey, you learn the most important things, because there's a lot of maybe fluff content in that just to fill the time in my experience. So again, something that could probably be restructured so that it could be, you still get the board's content, but the clinical relevancy, again, is questionable at best. So maybe it could be restructured. Next up, orthotics/prosthetics. Now this one, definitely board relevancy. I had a bunch of questions about it. I always hate, like the school we went to, we had a ton of content on this, and I see why, but at some point it became redundant, right? It's like even the board's questions, like all the same kind of same kind of knowledge needed regarding like the socket placement and like the amount of like socks and layers and like stuff like that. It's like, okay, I get it. So it's like another one where it's like it could be maybe a little bit not sped up, but it could be structured better. I mean, the way where I went to school, it was in the classes where it had relevance with ortho and neuro. Depending on the unit or what we were studying, it got integrated in, which I think is a perfect way to do it. I just maybe doesn't need to have the amount of time spent on it in it. But again, it's got the board's relevancy, but clinical relevancy, it's like how many of us are going to be working with that population? Very minimal. So again, maybe something that could be changed. Last up, health, wellness, nutrition. Kane, what do you got?
Oh man, this is another one of those topics. Like they teach things that are just so archaic and also that are just not really deeply thought out, in my opinion, right? Like one of the big things that I remember from this type of class was the discussion of dieting and how to get our patients healthier. And the big takeaway from that was they said diets fail 90+% of the times. And I'm like, okay, so what would you recommend for these patients if you're telling us that controlling your diet is not a successful thing to do according to the stats? There's no answer there, absolutely none. And we were also told that the person's like weight and metabolic health have no correlation. And I was like, this has been studied for years, decades now. I don't understand how we are actually pushing this agenda forward, that does not matter. Like, if we actually had something that was more beneficial, like, or more accurate, right? If we talked about how to make dieting more successful, that'd be awesome. You could really help talk to some of your patients. You're not like you're not a dietitian or anything, but you could certainly help to start guide them in the right direction. But the other thing that I'm curious about is, wouldn't this be more suited to be like an actual like therapeutic exercise class, like where you actually talk to people about exercise prescription and like different things that you could do to improve on your treatment methods? Because everyone knows this is a glaring gap when it comes to PT programs. They always say, learn on the job. That's what you're going to do. No one ever talks about any of these types of principles, right? So I think that this is something that could very easily just be substituted.
Yeah. And this kind of stuff's like, I mean, it's within our scope to give, I think, the way it's at least the state in general nutrition like advice. I mean, you can't bill or you can't give like a nutrition plan. You can't give like, I forget the term, medical nutrition advice, but you can tell people, hey, to lose weight, you need to be in a caloric deficit. And if you exercise, you burn calories, like stuff like that. And it's like, hey, yeah, we know that. Like, do we need a class where it's like a full separate class with this kind of information? And especially when it's been bad information being taught. And like you said, it could be replaced with something that's going to benefit us as PTs way more than the content in the class like that. All right.
Yeah, and so going from like those courses that seem extraneous, let's transition to courses that we think are pretty much vital for PT programs, right? So let's run through the list. We got anatomy, 100% needs to be on there. That for sure is going to be on like the backbone of a lot of your courses, especially for ortho. Biomechanics, I think, is also going to be helpful. You're going to get some boards questions on there regarding that. It's helpful to understand because you can apply it for almost every single aspect of PT, for ortho, neuro, peds, etc. Super, super helpful. Then you also have the core classes. You cannot be a PT unless you're exposed to this, right? And that's your ortho, your neuro, and your peds classes. I think those are absolutely vital.
Well, what about
you can
cardio,
toss in,
man?
You can toss that
The
in as
cardio.
well too. It's just not super popular. Could that be maybe a shorter course that you get exposure to it? Sure. Could you add it in as an elective for someone who wants to go into that field? Absolutely. But it is not a cornerstone of our practice for the most part, which I think is fair. It's just like it's a small niche. It's the same thing with wound care, right? Very small niche that people get into. So I don't think it needs to take. I don't think everyone needs to be have the same type of course load compared to someone who actually wants to get into that field. So there's also pharmacology, huge. I think that this is very important for the advancement of our career or of our of being a PT, because you need to understand how medications work, how they can interact with the patient, potential side effects and stuff, right? But you're still we're still doctors, and so that is definitely going to come within our scope, where we have to see like, hey, how is this affecting our patients, and do we need to actually discuss this with a physician, whether it be the PCP, surgeon, etc., whatever it may be, right? Imaging also follows a similar suit. We are exposed to images all the time, right? We may not be making the radiographic reading of them, but we still should be able to understand the terminology that they're using. We should be able to understand and make some basic interpretation of the image, so that way we can actually explain and have that conversation with our patients, which some patients are really, really hung up on that. So being able to steer that conversation well and navigate it tactfully, I think is going to be super helpful. And it's also going to tie into one of our points later on down in this episode. Exercise phys, huge. Ties into almost every single aspect of PT as well. This is our job. We need to know how exercise affects our patients, what their typical response would be, what an atypical response would be as well too. Huge, huge, huge class. I think it's super, super important. It's also heavily on your boards. I had so many exercise phys questions on my boards that if I didn't review red flags or common lab readings and stuff like that, or what a typical or an atypical response to exercise would be, I probably would have failed, because there were so many questions regarding that. Last one that I do think is kind of a toss up is a psychosocial class. It was a class that my program had. It essentially just teaches you how to be a better human being. It teaches you how to interact with people of different socioeconomic classes. It teaches you how to classify these people as well too, and see how they better respond to various treatments, because they may not respond to your stock standard care. Right? They may need a little bit more TLC. They may need a little bit more education, maybe more of a push for them to succeed with their rehab. Right? So that pretty much concludes our list of good courses. Mark, is there anything that you would like to add, or anything?
Yeah. So, I mean, we see a bit of a pattern here. Like, the courses that we think maybe could be changed or integrated differently are the ones more fringe, the ones that aren't going to apply to as many people, the ones that don't have much clinical relevance, right? And the ones that we feel should stay and be expanded upon are the ones that have the most clinical relevance, the most board relevance, and the ones that we, looking forward, are going to contribute to the advancement of our profession, right? So it's like, that's kind of what we're building on. Like I said in the beginning, we're not talking about, these are just kind of, we're going to talk about solutions, proposed changes coming up next. But we're not saying all this has to be done and changed all at once. These are just kind of ideas we're putting in here as people who are, concerned about how school is structured and the profession going forward. So let's look at solutions now. Talked a lot about some of the issues we see with the current PT school structure and the content being taught. Now let's begin to talk about how we would start to address it. So we talked about this a little bit before, but we talk about the length of programs. Programs are getting shorter. They're keeping the same amount of content, but there's no room for other kind of things to be added in. And we see as the programs are getting shorter, not only are we sacrificing some clinical development or just eliminating the room for any kind of coursework regarding clinical development to be taught, but the board's pass rates are going down too. So we're not, neither goals are being achieved, right? So I think a solution for here is stop trying to make these programs shorter. So we already have constraints with when it comes to time, with when it comes to content being taught. We talked about how maybe restructuring some of the classes and changing things up would give you more time, but that doesn't mean that you would continue to make the program shorter. I think if you continue to make programs shorter, like we've seen, like I said, boards pass rates are decreasing with those programs, and there's just no time for anything else. So I think it's a worrying trend within PT where it's like the programs are getting shorter, the board's pass rates are going down, and more students are being accepted. So it's like, it's not a great place for the profession. So it's like people aren't getting licensed, and also the people who are getting licensed are coming in like not well prepared clinically. It's just not a good look. So solution, either, not saying you have to make programs longer, but I don't think they should be made shorter. Again, like when we talk about some of the solutions going forward, we're going to talk about how maybe within the program length that you're giving, changing things so that you can get more clinically relevant courses. But that doesn't mean if we're taking some courses away or restructuring them, making them more giving more time to students, doesn't mean you're just cutting the program length.
Yeah, and I think that actually ties into our next solution like perfectly, which is improving the content and the efficiency of their coursework, right? Like we talked about some of these classes and how they could easily be condensed, right? Like, so I know for wound care, which is a very easy example, there are a lot of boards questions on it. Do you need a full semester to go over that content? I really don't think so. Does it need to be an in-person class? I also don't think so. Most of it is going to be like, oh, do you know like what dressings to use? Can you accurately measure and how do you measure the size of a wound, the depth of it? What are like best practices for it? Maybe you're going to go through like burns and the percentages. I believe it's called the rule of sevens, if I'm not mistaken, when it comes to burns. But yeah, if you honestly put that into an infograph, ship that out, done.
Yeah, give me a little booklet or something. Exactly.
It's just so much faster, right? So for some of these courses, they can easily be streamlined. They can be made asynchronous as well too. So common classes that could be done that could be done would be ethics, foundations, or EBPs, wound care, like I said, pharmacology, imaging. Almost all of these can be done asynchronously or in a hybrid format. We have advanced technologically. We can certainly do discussion boards, whatever it is. You can have Zoom meetings. You can do this during like your clinicals as well too. These are not super hard classes that are very information dense. So I think that is one of the ways that you can continue to improve on the efficiency of these courses. The next one is combining some of the coursework where you can. I think one of the big things is I mentioned psychosocial and identifying some of these patients. You can honestly just teach this as a quick thing for ortho, for neuro, etc. I think this is not something that needs to be a full class, but something that can just be brought up so people understand that there are different types of people with different types of socioeconomic backgrounds. Totally fine. We got the point across. We can move forward from there. Now, the other point is the fact that I think that some of these courses and curriculums are a little bit archaic, just like what we talked about before. Can a lot of these courses be held online? How necessary are some of these courses like foundations or the business class? I think that a lot of these are kind of just like they're models of what previous programs have done. And so it's like, oh, they did this in the past. I guess we have to continue doing it ourselves too, instead of trying to continue to refine your program and make things better and more efficient and effective. I think if we continue to do this, you're going to streamline the content a lot more. Students are going to, your time is essentially just going to be made that much more valuable and useful. And I think that a lot of that can honestly just be resolved by taking a different approach with these types of classes, right? So that's like my big thing in regards to changing how we're presenting some of that content and coursework for our students.
Right. So like going back to what I talked about with like program length, as you can see what Kane's talking about with regards to streamlining some courses, making some of them asynchronous, combining courseworks where you're able to, so you're integrating it into other classes and it doesn't need its own separate class while still getting the relevant information. That would free up more time. But that doesn't mean you just continue to make the program length shorter, right? I think it's short enough, but if we can free up some time, that gives us room to add some content to prepare people clinically. So some content that could be added that we propose as an idea would be early specialization, right? So how would this look? I think there's a couple different ways we can go about it. For example, you would have a scenario where you take your core classes, right? And then once you take your core classes, like we talked about, your anatomy, your biomechanics, kinesiology, pharmacology, imaging, exercise phys, stuff like that, then you could start to look at certain elective type classes. So what the program structure would look like would be you're kind of front loading the important classes. You're getting all of your information when it comes to boards and all the kind of information that you need in that regard, so that, again, you're passing boards, you're getting your license, and you're meeting all the standards set in by school. But you're leaving room for some early specialization. And I think the main purpose we're looking for with this early specialization isn't that, like, you're passing a specialty exam or you're getting certain certification or anything like that, but it's just to give you some exposure to the field, the specialty that you feel like you're going to work in, and then in turn that prepares you better clinically, right? So we have a combination of, again, a little bit of programming restructuring where you get all your relevant information first, then you would take some elective type classes where you'd be able to get some exposure to the specialty that you want to work in. And again, that would better prepare students clinically. So Kane, I'm talking electives, we're talking about some, additional classes. What kind of electives, what would these electives look like? What kind of classes would they look like? And what fields would these early specialization look like?
Yeah, I think like the big thing that we're trying to push with the electives, right, would be like when you front load the boards content and making sure that everyone is exposed to the cornerstones of PT. Mm-hmm. That at least gets your foot in the door for you to be a so-called generalist. And the electives essentially are just for you to express interest. These are your special topics classes, right? So for electives, for example, this isn't exhaustive or anything like that. But I think that having someone who wants to go into ortho, who knows they want to go into ortho, that there's a class that facilitates that, right? Like, why would you deny a student who's curious, who wants to learn more? This would have been perfect for me. I knew I was dead set on ortho. Any other niche could I perform in? Sure. Would I be excellent at it? Probably not. But I knew ortho was where my heart resided and where my brain best functioned, right? So first class could be an advanced ortho class. It could teach you more about spine. It could teach you more about manuals. It could teach you more about clinical decision making, all the things that aren't on your boards, but they make you a better clinician. That is the sole point of these electives, is not teaching you for the boards, but it's teaching you how to be a better PT. The next one I think is kind of a no-brainer is an advanced neuro course. This is where you can talk about different complex cases. You can talk about strokes. You can talk about spinal cord injuries. You can talk about different behavioral issues. This is where you can tie in the different prosthetics, amputees, stuff like that. The STIB, that is a huge, huge wormhole to go into. And this is actually where you can tie in more of your neuroanatomy. I don't think that the general PT needs to actually know neuroanatomy, but for someone who deals with a complex neuro caseload, would it help them? Absolutely, right? So I think that these are all very, very helpful. And a lot of these topics are kind of touched on in boards, but they don't go as in depth as what some of these classes should be doing. So it's just further exposure into the field. And at least it gives the students a chance to see what some of this is going to be like before they commit to something, right? Like, at least if you think, I might have an interest in neuro. Let's check it out. Let's see what it's like. Get you ready. And then you can maybe dive into a clinical rotation and see what that's like. And you're like, oh, I did not like this. Right. Then you found out you don't have to work in that career, in that niche, right? So it definitely gives you a lot more ways to get your feet wet in determining what kind of niche that you fall into. Mm-hmm. Now, the next ones would be like advanced pediatrics or imaging if you really want to go down that route. And once again, psychosocial is if you really, really want to go into more of like pain science or identifying these people and how exactly they respond. So, Mark,
and this could be something like this could be something too. It's like, not like, if there's room in the curriculum, if there's enough time within the program, it's like, hey, this isn't something where you take one. Like, maybe you could take 2 or 3 of these where it's like, hey, I know I want to do ortho. I really like spine, and I really like manuals, and I'm really interested in, like, what imaging is going to look like for PT. So it's, hey, you check your boxes. It's like to a prospective employer, just like personally for development wise, it's like, hey, I already have taken coursework in spine manuals, and I have some imaging exposure. Or maybe on like the neuro standpoint, it's like, hey, I do a little bit of a STIB, and I really like SCIs as well, right? It's like you could start to mix and match, and like you can start to get a little bit of a professional clinical identity before you're out of school, rather than kind of having to wait, get some exposure, maybe get like mentorship, whatever else afterwards. You could start to get that level of knowledge and learning before you leave school, which I think is a very strong, powerful way not only to help individuals, but also start to advance the profession. Like when we start to look at other healthcare professions, whether it's physicians, PAs, whatever it may be, like these people are kind of like, they're very specialized when they come out, and they specialize basically like within school. It's kind of like part of their, whether it's clinical rotations or part of their actual curriculum or coursework, like they're specializing, right? Where it's like PT, especially when we're talking ortho PTs, like you come out, it's like a little bit of everything, and then you kind of just do a little bit of everything. And if you don't catch on to anything, you just continue being a generalist, which isn't a bad thing. But I think when it comes to the profession advancing going forward, I think getting some kind of specialization. So it's like, hey, like, you want to be, you have radicular pain coming from your lumbar spine. It's like, yeah, you go see this person, right? It's like, oh, you have anterior knee pain, you see this person, right? So I think specialization early on can be beneficial. So building on that, we have these elective type courses we have that can be taught within school. We can start to debate the level of difficulty within these courses, right? I think they should be courses that, again, the main goal is to prepare people clinically, but we can also start to think about, hey, maybe these courses shouldn't just be type of classes where you just walk in and pass. Maybe they should be a little bit more rigorous. Maybe they should require higher levels of thinking. Maybe even they should be like at the point where they're like, almost like a informal pseudo residency type thing, where it's like, hey, like the purpose of these classes really get you to dive deep, think hard, and really evaluate your clinical decision making skills, again, within the learning capacity of a PT school student. But again, you're going to have all your content front loaded, then you're going to get some specialty content within these classes, and then we can start to emphasize within these classes the critical thinking and decision making process, again, the clinical skills of physical therapy versus just learning information, which you're going to learn in all the other courses that have been front loaded.
Yeah, I think that this is such a huge thing, because this is easily the thing that separates like good from great as well too. I find that if we are actually pushing our students and holding them to a higher standard, we are going to move the field in a much better direction. I I don't know, maybe I am too harsh in my thinking, Mark, but honestly, I think that we're too soft on our students. I think that higher level thinking can really be achieved fairly quickly if you are pushing yourself to do so, if the faculty is pushing you to do so and leading you and teaching you how to connect those dots and how to develop that system. That is pretty much what we've talked about in so many different episodes. We have condensed that down so well. I think that this is something that really, really should be prioritized. And I think that that's just going to elevate the standard of students as well as future PTs. Now, Mark, I think that one of the big things that we talked about with the electives, right? Like these things aren't really geared for boards. Now, if you go from learning all of your boards content and then you're learning all these new extra things, what about all the things that we learned, right? I think that there's definitely two ways to really attack this. One of them should honestly be a guarantee. Boards prep courses. Listen, I was given a 2-day workshop. Mark, I think you were given a week workshop, right?
Yep.
It's your boards. You would think that they would spend more time on this instead of just a few days. I've talked to other students before, and they pretty much had the same experience. Oh, we didn't really have a boards prep. They just kind of told us to buy this book. We took the PEAT, and now we're going to sit for our boards. Listen. Your entire program is measured by how many people are passing your boards. That is what most new candidates are looking for, right? If they don't have previous exposure or any experience with your program to say, oh, this is a good program, they're going to do a great job here, they're going to gravitate towards that stat. So why not put more emphasis on that? I think that boards prep could be so helpful. And this could be another thing that could be taught online during your clinicals, making sure that you're freshening up on those core topics, maybe on some of the topics that you don't really want to study. I'll tell you, like cardiopulm was not something I was an expert at. Neither was peds. Those are the things I would have loved to have a refresher on. And that way it teaches you different strategies. And it's just like more exposure to it, right? I think more exposure to that type of content is just so helpful because it keeps it fresh in your mind, which ties into the next suggestion, which is something that I faced in my athletic training program, which were cumulative exams. At the end of the first year and at the end of the second year, you were given an exam that covered the entirety of the first year, and the final exam covered the entirety of both years. All content, all procedures and skills were fair game. You sat in on that exam. There was no prep. You just took the test and you either passed it or you failed it, right? And if you failed it, you'd remediate. If you failed it again, you got kicked off the program. So it is one of those things that puts more pressure on you to stay consistent with your studies. I think that is so helpful. It sucks going through it, but I will tell you, I was that much more prepared for all of my skills afterwards. Like it keeps the knowledge fresh and current, and it forces you to continually review throughout the year or when you're going through your clinicals. You cannot tell me that going through your clinicals is so stressful and so tiring that you can't spend an hour or two reviewing some stuff, right? That.
I like this idea. It's almost like a check, right? Like, and it could be formatted so many different ways. I like the cumulative aspect is certainly good, right? It requires you to stay up to date on stuff. It could also be something where it's like, hey, like, maybe they give you like a list of 10 possible topics that that they could cover, and it's just like, hey, like this is what you need to know, and you're gonna get tested on it, and it's like not like giving stuff away, but it's gives you a little bit of guidance at least. But regardless, it's something that requires you to stay on top of things, especially in like the one like hypothetical program structure where the board's content is front loaded. Like, hey, you're gonna have another year and a half of like not doing this stuff. Like, we gotta have some way to know that you're keeping up on it and you're still keeping the information fresh. So cumulative exams is one way that could be achieved.
Yeah, and the other thing is it also preps you for test endurance for your boards. If it's cumulative for the entire year, I'm pretty sure my exam was about 3 hours long for both exams, right? So you're given a good chunk of time and a lot of questions to go through. The same way that you would have to sit for your boards. That is one way to ensure that you have some test stamina going into that. And it's just going to better prep you, right? Like that I think could be a huge thing that you could start to implement to make sure that your students are staying up to par on their basic and foundational knowledge. Now, the next couple of things I think are also very important for ensuring that the quality of PTs that are going into school and coming out are going to be better. And that is doing quality control on your students. And that comes both from having higher standards when you're accepting your students and making sure that, okay, these are the people that I want coming into the program. This is why they have maybe good GPAs. Maybe they have, really good extracurriculars where they're showing that they're going above and beyond. Maybe they took a non-traditional route. For example, like myself, I didn't have the best GPA going into my graduate programs. Instead, I took a different route and went through the athletic training career. And that really propelled me forward into a great position. They're like, oh, tell me more about how this is going to help you as a PT. Boom, done. Right? Very similar skill sets and things and knowledge base. So that was pretty much what made me a shoe-in. Now, the next part is going to be addressing poor performers. This is a worrying trend that I have seen. Students that are getting pushed forward to pass, whether it's for clinicals, whether it's for their exams. This is something that you should have a strict criteria on in regards to, are they going to make it through or are you going to get the boot? And then also, students that are struggling, what is your game plan to help them get better? I think that is like so important to make sure that you're still capturing those people that you can help and that you're giving them a fair shot. You're trying to help them because they're going to help themselves too. The people who don't deserve to be there, you gotta give them the harsh reality that they're probably not cut out for this career at this point in time. They could try again in the future. That's totally fine. But right now, based off of what you're seeing, it's just not in their cards. Now, that ties into dismissing those poor performers. And you have to be willing to have that tough conversation. Because if you are pushing some of these people through, can you imagine the type of culture that this fosters? When you accept poor performance or poor behavior, when you tolerate it, it essentially means that it's okay for you to do this. It's okay for you to fail. You're going to be able to get a second, third, fourth chance. That should not be routine. That should not be the norm. You should be able to say, here, these are the great things that you're doing. Encourage this. These are the things that are unacceptable and they should be punished, right? That is essentially what's going to breed a good culture for students to continue pushing themselves and each other to be better people. And I'm not saying that you can't have like a friendly and collaborative cohort. What I'm saying is you need to make sure that things that are unacceptable are not tolerated. Like that should be clear cut. And that, I think, is what could make a huge difference in regards to the students that are coming out of the program and the standards that they're holding for themselves as well, too.
Yeah, like there clearly has to be some, like, even we talked about the board's pass rates for the shorter programs or the programs that are becoming shorter and how they're decreasing, but it seems like across the board, board's pass rates are just decreasing. So it's like we see the more students getting accepted. Like it's certainly possible that it's like their students are getting pushed through and they're getting kept on, and maybe these students who aren't doing well in the coursework are contributing, that are getting pushed through and sticking around, are contributing to the lower pass rate. Again, I don't think we have like hard data to say that. Actually, again, I know we don't have hard data to say that, but it's just something that from our personal experience and what we've seen, not only within school, but our experience as like TAs, like, yeah, sometimes people get pushed through. And I see, I guess, the motivation from the school to want to keep students, so they can, I guess, make more money. But from our profession, it just doesn't look good getting people to come through. So there needs to be some kind of quality control. Like maybe it's even something people where it's like, Kane, you talked about the one elective maybe being a boards prep or something like that. It's like, hey, maybe if you are a high performing student, you're not required to take the boards prep, right? But if you're someone who isn't doing as well, boards prep is mandatory, right? Something like that, like simple changes that can be made to ensure that not only the school's successful, but the students are successful as well.
Now, Mark, so we talked about how these things could potentially impact the profession, right? Like having that higher standard, creating better, allowing better students in, and creating better clinicians. How do you think that this could improve the profession?
Well, I think you're just gonna have better people coming out, right? It's just like I think like in the beginning of this episode we talked about, yeah, you got to pass board, you got to get your license, and the people who are getting a license are going to be better prepared clinically coming out of school. So it's like, again, it's just like, hey, you're going to have people coming out with specialized experience. You're going to have people coming out, and you're going to have better quality control. So the people coming out are just going to be at a higher level in general. Like I think for the profession, you're just going to have, again, better prepared, more knowledgeable people who are starting their career at a higher level. And if they're starting at a higher level, it's only logical to think that they're going to end at a higher level as they continue to learn.
Yeah, and I think that if we continue to do this, if we're creating better students, better clinicians overall, this is going to elevate our standard of care. And this could be one of the ways that we're taken more seriously. This is one of the ways that we can improve on how we're currently being reimbursed and valued as a doctoring profession. Maybe we're going to be able to continue to expand on our scope. I think that that would be huge, right? Like that's the whole point of this, is for us to continue pushing the field forward and elevating that status quo. That is like the whole reason why we wanted to do this, is because we want to make better PTs overall, right?
Yeah, like Kane and I are clearly passionate about the profession of PT. We see how we fit into the healthcare system. We see how much more we can do and achieve, and we understand that, like, or at least right now, like we don't see, I said the single goal of school has been to pass boards, but what about the clinical aspect of PT? What about like, what if things could be changed, things could be restructured in a way where it's like, hey, we're still passing boards, people are still getting licensed, they're doing really well, but look, we've changed the program a little bit to restructure things so that we can start to prepare you better clinically as well. It's like, that's the kind of school I want to go to. That's the kind of standard we are trying to set. And again, if we can start that in school, then we can start to foster that culture going forward, so that to not only help people on an individual level, but help the profession as a whole advance and just do better for the profession overall.
This is the one thing that actually drives me kind of nuts, is because you hear it all the time where they say, oh, your actual learning starts after school, once you're on the job.
Thing, right? It's like, oh yeah, here's your $100,000. Thanks for, now I get to learn.
Yeah, like that to me is just so crazy. I get the sentiment behind it, but it's like, we could do better. Like this is so insane that they think that that is acceptable to teach you how to be a very average clinician. Most of the times when you come out of school, the expectation for new grads is you know nothing. Why is that the expectation when you are now, quote unquote, a doctor? Right? You should have higher standards coming straight out of school. So that way we can continue making these things better. So that way you're actually equipped to do a better job than all the other people around you. Right? I think that is massive. And that is how you continue pushing that agenda forward and improving on the status quo for current clinicians. You got to start from the ground up, which is going to be the school system and the students, in my opinion.
Okay, Kane, anything else you want to add to today's episode?
I think that we discussed a whole lot. I think we got a lot of stuff off our chest about some of our more traumatic PT school experiences, and honestly, how we could make things better for the future, and hopefully not scar as many people in the process.
Yeah, like we want to reiterate today, like we just some ideas we're throwing out there. We're not saying any huge drastic changes need to be made immediately, but we think there's some changes that can be made that could not only preserve or in this maybe improve the board's pass rate, but also prepare students better clinically. So we talked about maybe restructuring or cutting some classes, replacing them with maybe some elective based classes that would help people prepare more clinically in their relevant specialty. We talked about not necessarily changing the structure of these classes would allow for more time for these things. And like the continual trend of cutting program length doesn't seem to benefit students in the clinical aspect or the board's pass rate aspect. And like we talked about at the end, like some earlier specialization, getting students more prepared for clinically, not only helps them at an individual level, but also helps advance the profession in general. Well, that wraps up another episode of the PT Good Podcast, the #1 motivational and educational ortho PT podcast. Subscribe to us on whatever platform you're listening to us on, YouTube, Spotify, or Apple Podcasts. Don't forget to share this with others who would benefit. Thanks for listening. We hope you enjoyed, and we'll see you on the next episode.
Miss you, love you, bye.